Welcome to Dr. Balga's podcast for the Curious Doc. Today is March 28, 2026. This video is on a New England Journal of Medicine article published 3 days ago, March 25th, 2026, titled Early Surgery or Conservative Care for Asymptomatic Aortic Stenosis at 10 years. Asymptomatic, very severe aortic stenosis carries low sudden death risk, less than 1% per year, but prolonged pressure overload may cause irreversible myocardial damage. These investigators conducted a randomized, multi-center, open-label recovery trial. Sample size 145, 73 had early surgery and 72 had conservative care. Population asymptomatic, very severe aortic stenosis, aortic valve area less than 0.75 centimeter, peak velocity greater than 4.5 meters per second. Mean age of the cohort 64 years. There were baseline characteristics were balanced. Median follow-up nearly 12 years, 144 months. Primary endpoint operative mortality, the death in 30 days post-surgery, or cardiovascular death. They use an intention to treat analysis, Kaplan Meier estimates, log rank test, stratified Cox proportional hazards with correction, and hazard ratio with 95% confidence interval. P-value less than 0.05 was considered significant. What did they find? The primary endpoint, 3% with early surgery and 24% with the conservative approach. Hazard ratio 0.10, p-value 0.002, 10-year incidence 1% versus 19%. All-cause mortality 15% in the early surgery group versus 32%. Hazard ratio 0.42. Heart failure hospitalization 0% in the surgery group versus 19% in the conservative group. So the number needed to treat was 6 for cardiovascular deaths and 7 for all-cause mortality. What was the limitation of the study? It was open-label design, so there's ascertainment bias, small sample size, few events, highly selected, relatively young cohort, limited generalizability since this study was done in Korea, no routine exercise testing, and TAVR comparison is unclear. Key takeaways: early surgery significantly reduces cardiovascular mortality, benefits sustained over 10 years, preemptive intervention may prevent irreversible myocardial injury, challenges traditional watchful waiting paradigm. Clinical pearls: early intervention in very severe aortic stenosis alters long-term survival trajectory. Timing matters. Delayed surgery increases cardiovascular risk. There was a high crossover rate, 85% in the conservative arm, underscores the inevitability of intervention. Zero operative mortality highlights procedural safety in expert centers. Patient selection remains critical for translating benefit. And TAVR has emerged as an important therapeutic benefit which was not studied in this trial. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.